Let's talk about abdominal pain without diarrhea, without fever, without body ache. Abdominal pain is very complicated, and so I have divided into 3 sections. I'm just talking about abdominal pain that is not associated with fever, body ache, or diarrhea. Let's talk about generalized abdominal pain. Also, if you really exercised hard for your belly muscles, sit-ups, any type of belly exercise, golf, strenuous exercise, muscle building, also cause abdominal pain. So you need to touch your belly and see if it's a muscle that hurts. And so these things, if you stop exercising, you'll get better. So you need to think about that. Usually it's from nerves. Anxiety, nervousness, not sleeping. These cause common abdominal pain. We call it irritable bowel syndrome. Nervous stomach. And it causes abdominal pain. Sometimes it causes diarrhea, but sometimes it doesn't. So I include it here. If you have a nervous stomach, nervous intestine, you have crampy pains, but not during sleep, not at night. Only during the day when you're awake. You don't wake up because of abdominal pain. If you do, it's most likely, not 100%, most likely not irritable bowel syndrome. These things you need to go to the doctor and take proper medication. Also, for generalized abdominal pain, you could be taking some medicine, like laxatives, diet medications, sometimes cocaine, street medications could cause abdominal pain, and usually goes away if you don't take this medicine. If you have abdominal pain in the upper abdomen, this area, you have to think about stomach, especially if it's burning pain, acid reflux type of pain, sour feeling, then most likely it's from stomach. And this sour feeling, burning pain, gets better with Mylanta, and food or milk is most likely from stomach. If you have taken aspirin, Motrin, Advil, common cold medication, some type of pain medication, Alka-Seltzer, NyQuil, all this thing could cause stomach problems, gastritis, and cause burning pain. So you have to think about that. Also, duodenal ulcers, inflammations. Occasionally, pancreatitis and hepatitis doesn't cause fever if it's mild. So you have to think about that also. The flank area is a little different from abdomen, so I won't go into flank, which is in kidney. You have kidney problems, then it's a flank, but we usually don't call it abdomen. But usually kidney stone could come down and cause lower abdominal pain from flank pain. So you could have kidney stones, but it's usually very, very painful. And so you have to go see a doctor for that. Also, if it's lower abdomen problems, now you have to think about colon, colitis, diverticulitis, but usually they have fever. But sometimes you don't. Cancer, pelvic problem such as ovarian cyst, uterine mass, sometimes could cause problems. Appendicitis usually have fever. And other problems that does not have fever and body ache, nausea, vomiting, and diarrhea are ileus, which is not moving, a lot of gas, intestine not moving. It could be from medicine, or it could be from previous surgeries, obstruction. So you need to think about those things. Also, you have blisters in your skin. Anywhere in your belly, it could cause pain. And it's not from inside, it's from outside. It's shingles, herpes zoster problem. So you need to go see a doctor for that. So all these things, you could have no fever and pain. If you have cramps, sometimes from stress or some weird food, you could get stomach could cramp up and stop moving. This usually goes away by itself with time, after sleeping or relaxing, hot bath. So this is also from stress related. So this thing, you need to go see a doctor, but usually it just goes away by itself. If you have a pain in the right upper quadrant area, you have to think about gallstones. If you have gallstones and there's no pain, usually, you live for a while without any problem. You do an ultrasound, you found out you have all gallstones, and no problem, you don't do anything. But if you have a gallstone that traveled down through the common bile duct, then it causes pain. Severe right upper quadrant pain, or sometimes epigastric pain, or sometimes left upper quadrant pain also. So if you have upper abdomen pain, which is very severe, you also have to think about gallstones. Lastly, it's pretty rare, and it only occurs to sick people who has atherosclerosis, arterial blockage. If you have an arterial blockage to the blood supply that goes to intestines, the intestine get angina, they get ischemia, and poor oxygen supply. Then they cry out for oxygen, and it causes pain. And so these people, they need to go see a doctor. You need to supply oxygen, blood supply to intestine also, to get proper digestion, proper movement. But if you have poor circulation to intestine, then you get pain, angina.